try your best to practice the 6 feet social distancing. It's something that we have been embarking on over the last couple of weeks, moving around. I've been around in about 6 parishes over the last 4 or 5 days, from Montego Bay all the way back now to Kingston. And it's a standard feature of the work of the community health aides. Behind me in the backdrop here you see these community health aides. We've hired so far almost 1,000. We are going to hire an additional 300 to 400. They have been trained, and a big part of their job is to go out in communities, in town centers, and be the COVID response representative on the ground to encourage the message, which is so important for everyone to follow, particularly in this time when we're having community transmission. So I'm out here to give them support. They are out here daily, and the appeal again is to Jamaicans, wherever you are, to follow the protocol by wearing the mask. I understand that between Saturday and now we have given out almost 6,000 packages with masks, sanitizers and information in this vicinity, in this area. We're doing this across the country, and it's going to be more a feature of the Ministry of Health and Wellness response. I want to just say finally that the message cannot be repeated enough, that really responding to COVID is up to all of us to play a part. And as it relates to town centers, public spaces, the protocol around mask wearing, sanitizing, 6 feet distancing is the standard feature no matter where you are. And that's the message that we really need to get across to all concerned.
For the last 7 days we have been to Lawrence Tavern, all the town centers from Lawrence Tavern, Stony Hill, Golden Spring, Essex Hall, Parks Road, Constant Spring, Halfway Tree, Cross Road and Downtown Kingston. And we have been teaching persons how to actually put on the mask, how to take off the mask, how to discard it, proper way to sanitize your hand, proper way to do hand washing, and how to dispose of the garment, the gowns and so on. We have also been educating the persons, of course, maintaining the social distancing, and if you are ill, stay at home. That's basically our message.
I wouldn't say that the spike is unending. I think it's going through the cycle that was expected. However, we are intervening to try and control the numbers. I think the team on the ground have been having some impact, but I can fully understand why Jamaicans would be concerned because of the deaths and because of the number of positives. We have to maintain the underground presence, which is why the community health aides are so important. We have to maintain the messaging around persons taking on the responsibility to wear the masks, to sanitize and so on. And while we do that, we have to prepare the hospital system to treat with persons who are so affected. As it relates to movement and restrictions of movement, that's an ongoing process that the cabinet assesses periodically and makes decisions on. And if there's a need for that outside of what we have now, which are the curfew hours, then I am sure we will announce that in due course. But right now, what is absolutely critical is that we follow the protocols and that the team is on the ground working, providing information, personalizing the information, and trying to get Jamaicans to comply with what is important in their own interests.